So just so we are clear, when we talk about erectile dysfunction, we are talking about the consistent or recurrent inability for young men to or achieve erection or maintain erection for satisfying sexual performance. So it doesn't have to be once or twice, which can be normal, but if it is something that's is occurring, reoccurring all the time, and it is not able, like it is hindering the satisfaction of this person, then we classify it as erectile dysfunction. So I was just wondering, reading around, what could be the causes. I mean, before this, I did find this report, which is quite I'll say high, because the number of young men who are just below 40 getting erectile dysfunction medication is really high. Yeah. So the causes, it could be psychological. And when we talk about psychological, it could something related to the brain or to the mind. And one of that is what we called performance anxiety. So most guys are really, really anxious about the father. What will I do? How will I be able to perform? Will I be able to do it well? And so they are so much anxious about that, which can lead to inability to achieve and sustain erection when there is time for the intimacy. There is also stress, and that is something that everybody goes through, because we live in difficult times. There are so much pressures, work related, financial issues, and so all this stress actually work on people's health, suppressing their boost and ego, and this can actually affect the production of testosterone in men. So stress is a really big factor when it comes to this. There is also people with depression and anxiety issues. One, the depression itself actually affects their libido. It makes it very difficult to achieve erection. And sometimes the medications for treating depression also affect their testosterone levels. There is also people past trauma, sometimes from past relationships, how much they were maltreated or unsatisfactory relationships can affect the way people perform and also affect their cause what we call erectile dysfunction. So apart from the psychological causes, there is also what is termed porn-induced erectile dysfunction. Now, this is actually happening because there are a lot of young guys who are hooked and addicted to pornography. And so their mind or their brains has actually been wired to only get aroused when they actually view pornographic materials. So when it comes to physical intimacy, when they are left with themselves or with their partners, with no presence of pornographic materials, they go flat. So their brains are not able to connect it or differentiate between real life and then pornographic material. So this porn-induced erectile dysfunction is also a huge factor. Now we have some that are related to lifestyle, and it's sometimes it's actually because of habits like excessive alcohol intake or smoking. Smoking cigarettes, even occasionally, reduces blood flow So a reduction in the blood flow to the sexual organs will cause inability to achieve erection or maintain erection for a satisfying sexual performance. And there is also lack of exercise. So when you exercise, you actually increase your heart rate increases and your metabolism is perfect. So if you become so docile, inactive, leading to obesity and issues like that, it affects the testosterone levels, it affects your libido, it affects how you are able to perform. So our lifestyle, as well as what we eat, there are a lot of people actually eating so much junk these days. So all these junk foods, not good for the heart and causing problems, like, because you need adequate blood supply to the sexual organs to be able to achieve this. So those are some causes, but there are also like the use of medication. Apart from prescribed medications, people use recreational medications which affects them, like the use of cocaine, ecstasy, marijuana. These are known to affect and impede on sexual performance. Medical conditions like diabetes, hypertension, even though it is not so common in young men, can actually lead to erectile dysfunction. So that's some of the causes I've been able to identify so far. You probably have an idea what could be the causes of erectile dysfunction. If you have any idea, you can just drop it. I'll read it out, and then those also watching this live will benefit from it. Also, there could be hormonal imbalances, because even though testosterone is actually needed and essential in sexual functioning in the male, in men, there are other hormones as well. So for some men, they have more prolactin or progesterone, which is a female hormone, than testosterone. It is rare, but it happens. So if you have these hormonal imbalances, then it actually affects the sexuality or the sexual performance of the man. So what could be done? If you are able to identify or isolate what is the cause of your problem, then you are almost about 50% solved. Okay, the problem is about 50% solved. But we should keep in mind it could not be just one cause. For some people, it could be a combination of so many things. It could be stress, it could be inadequate exercises, it could be trauma from your past relationship, or it could be a medication you are using which is actually affecting your performance. So ability to identify these causes will actually help you know which steps you want to take. So if it is something psychological, then if you treat the stress or you treat the root cause of it, you are about 90% there. Or if there's a need for therapy, you go for therapy. If it is something physical or something related to your behaviors, such as too much porn usage, because a lot of young guys, they are just hooked to it, they have no idea the negative impact it's got on them, then you just isolate it and you go on, say, a 30-day detox, where you say, okay, for the next 30 days, I'm actually going to abstain from any pornographic materials and actually do a mindful or focus on a mindful arousal stuff and see if that really help. So the main thing, I guess, is to know where the cause is coming from. If you are unable to identify it, speaking to a health professional, a health worker, a doctor would really be able to find, you'll be able to find out something. Sometimes deficiencies in certain vitamins are also a real cause, especially when you are deficient in vitamin D or zinc. It's really, really have a negative impact on men, even the B complexes like vitamin B6. So a blood check will be able to rule out this, and you'll be able to find where you want to go and how you want to correct it. But generally, if you focus on managing your stress well, and let's be frank, everybody's got some stresses they are going through, but doing one thing at a time, not becoming so overwhelmed and consumed by your stress, will give you time to wind off and then focus on yourself as well, your self-pleasure as well. So if you're able to identify the causes, we know how we can go about it.